On today's show, we have with us Dr. Waine, a lecturer at the University of Papua New Guinea Medical School, as well as a local surgeon at the Port Moresby General Hospital. Thank you for being with us today.
Thank you very much for having me.
Thank you. Before we continue, can you tell the viewers a bit about yourself?
Briefly, I do a lot of teaching at our medical school as a senior lecturer in surgery. So I basically teach a lot of the surgeons in this country. But apart from that, I do some honorary, what they call honorary, means some work done at the hospital, Port Moresby General Hospital, the National Tertiary Referral Hospital. So I do two days in a week, do operative surgery at the Port Moresby General Hospital and do my ward rounds and look at the sick people at the clinics. So I feel I do a lot of work at the hospital also.
Great. So can you tell us what are the most common forms of cancer in Papua New Guinea amongst women?
Yes, cancer, I got 3 on the list, especially for women in Papua New Guinea. The first and foremost one is the cervical cancer, cancer of the cervix. That's part of the, in Papua New Guinea we call it neck bilum beginning. So there we are. That's where the cancer often and a lot of times happens on this particular side. The next one on the list is on breast cancer in women. Unfortunately, we are seeing guys with cancer of the breast too.
Wow.
So at some point in 5 or 10 years' time, we might change a little bit in that sentence. And the next one is the cancer of the intestine. Okay, not to say that we don't see cancers of the blood and cancers of the bones and the brain and all this. We do have them, and also cancer of the mouth. It's also coming up, but those in terms of the preference, so in terms of listings of commonest, cervical cancer, breast cancer, and intestinal cancers.
There's been an increase in cancer, especially you've mentioned breast cancer in men. Well, why do you think?
Let me start with the women first.
Okay, yep.
Let me start with the women because the woman breast cancer is so many factors they are associated with. One of the commonest one is genetic. If your mom and your aunties are having a breast cancer or die from a breast, sore or cancer or ulcer, more likely that the daughter and the cousins down the track will have that genes likely with cancer on the breast. That's a common associative factor. The other one is that people are seeing lifestyle changes, and commonest ones, betel nut and smoking and alcohol intake and more refined diet these days. They are associated with cancers of not only the breast but intestine and elsewhere. So diet is a big factor now, and the change of lifestyle pattern. That's a big problem now. And the other thing is that one of the things they also associate is that ladies tend to have kids. They delay their pregnancies. They think they will finish their colleges, they finish the university degrees and stuff like that. So they everything their kids about age 35, maybe up 30, beyond and after 30. And they said the chances of having cancer of the breast is also high in ladies who delay pregnancies. And that's something that's done overseas, Australia, in the developed countries. We need to do it in our own setup to find out whether that argument can be scientific or evidence to it. But yes, commonly speaking, they do have this trend now. So it's not just 1 + 1 = 2 things, but it's something that associated factors build up over time, and plenty of those factors, risk factors that then cumulatively give rise to cancer, especially of the breast and the cervix and maybe intestinal.
And what are the symptoms of breast cancer and cervical cancer?
Yeah, it's a big, symptoms widely. Cervical cancer in women is when they see, they lose blood. They see blood, especially during the periods, and they're seeing prolonged, normally see 4 days, and now they're seeing 6 days or 1 week. The other thing is that they probably have developed pains around their, pelvic area or around the region of inguinum, they call them. Then, they start worrying. Other times, they kind of lose weight. But most of this, unfortunately, in our society, they don't tend to come quickly to the hospital. They stay and they forever stay at home or wherever they are. And by the time they come home, maybe they're crippled or they are losing weight, they don't have the strength, or they're losing a lot of blood and they're very anemic. That's when they come in wheelchairs and stretchers. That's the time we realize that they got cancer and they've been away from hospital. So it's normally it doesn't happen, suddenly. They just take time. These symptoms, things, yeah. It takes time.
And what is the treatment available?
The treatment available in this country, I've been saying it to some meetings elsewhere, especially the recent one was in PNG Women Forum. Cancer treatment is very difficult in this country, and we don't have proper facilities to take care of. The one in Leh is a cobalt machine. It's outdated. We need, what they call a linear accelerator for radiotherapy. We need medicines for, to treat cancers, but we don't have oftentimes, we don't have it, on time. Surgery too is, it's a lengthy process. We do surgery with big operations, wasting a lot of resources. My advice would be to advocate for people to come in quickly for checkup, whether it's a flu or it's a fever or it's a pain. Make sure go to a hospital, make sure go to a health center facility. Somebody must get checked by a nurse or a doctor or somebody.
Well, we're running out of time. Maybe you can tell the viewers certain points that you think that you like to stress to the viewers, if you can.
Yes, on the cancer per se, I'll advocate for people, general public population, to come and seek advice or checkup in the early part of the disease process. It may be just flu, that's fine, but if it's not flu, it may be something big, So it's nice to come and go to the hospital, to a health facility, to post quickly and get checked properly at the first instant, so that we don't deal with cancer. We're dealing with a malaria or a fever, which is good, which is treatable. Cancer, it's impossible. And oftentimes I call it a deadly disease. It's a death sentence in this country.
Well, thank you so much for being with us on the show today.
Excellent. Thank you very much for having me, Diane. Thanks.